Since 1994, AMSANT has played a major role in advocating for Aboriginal people's right to control our health services. Community-controlled health services have long been a concern for our people, and as early as the 1970s, health organisations began to form. In 1973, leaders of the Central Australian Aboriginal community organised the first meeting to talk about the need for improved health services in Alice Springs. The Central Australian Aboriginal Congress was formed. Congress led the way for other Indigenous organisations to join the fight. AMSANT was born in 1994, and for 20 years we've been keeping Indigenous health services at the top of government and community agendas. We've seen significant changes to the administration and delivery of Aboriginal healthcare, changes that deserve celebrating.
It's a huge advantage to have Aboriginal people in control of their health and well-being. We've come a long way. We have now 26 members which form the AMSANT membership, that we're probably the only jurisdiction nationwide that'll close the gap by 2031.
AMSANT was established after a 3-day meeting of community-controlled health services in the Northern Territory. Initially called the Council of Aboriginal Medical Services Northern Territory, the organisation's key objectives were greater community control, more resources, and improved training, salaries and conditions for Aboriginal health workers. Several key conferences and historical summits followed.
It's time to rethink, reconsider where we can get resources and how we might distribute them more equitably.
AMSANT's first major campaign was to have administrative responsibility for Aboriginal primary health care transferred from ATSIC to the Commonwealth Health Department.
And it may be simplistic, but one of the things we thought to try and create some of that order was to make the Commonwealth Government totally responsible for expenditure to us on health for primary health care.
In October 1998, more than 150 delegates attended the Central Australian Aboriginal Health Summit at Ilperla Outstation. The summit was a historic occasion, the first time such a large group of Aboriginal community representatives had gathered to look at the state of health on their communities. The following year, more than 200 delegates attended the Banajal Health Summit.
Great to be here at such a historic occasion.
The view that people took at the Ilperla Summit was that we have to take health into our hands.
Thanks, Mick, and thanks very much to Danila Dilber and Pat Anderson for asking me to come and help out.
My name, as you now know, is Wes Miller, and I'm the Executive Secretary of AMSANT.
Once again, this gathering provided a forum for organisations and communities from across the Northern Territory to discuss their health concerns and examine ways of improving health.
God be with you till we meet again.
1 year later, another significant summit was held in Arnhem Land at Gulkra.
I'm really happy to greet you to Kanbalabula land.
Together we can demand government to hear our voices and take notice of what we say when it makes decisions.
The Gulkra Health Summit theme was Family is Life, and it focused on family relationships and the crisis facing children and young adults. The summit also set up and ran male and female clinics at the Gama Festival. In 1995, when AMSANT began a campaign to improve the administrative arrangements for Aboriginal primary health care, the setting up of transparent and accountable planning structures was a key objective. With the signing of the Framework Agreement in April 1998, the structures came into being. Since then, AMSANT has chaired the Northern Territory Aboriginal Health Forum, and from 2006 its successor, the Northern Territory Agreement on Aboriginal and Torres Strait Islander Health. Through both bodies, AMSANT has worked to ensure that the funds and planning processes result in appropriate and functioning primary health care services. AMSANT successfully campaigned for the Commonwealth Government to cash out Medicare funds for Aboriginal people living in remote regions. This generated extra funding for the provision of primary health care and created a mechanism for developing regional services. The campaign also led to the Aboriginal Coordinated Care Trials in the Northern Territory and the 1999 budget announcement of the Primary Health Care Access Program. By 2001, AMSANT and Forum had secured Primary Healthcare Access Program funding for 5 health zones in Central Australia. AMSANT continued to lobby extensively for the program to be funded beyond its legislated timeframe.
The Primary Healthcare Access Program currently receives $64 million a year from the Commonwealth Government, support which AMSANT says must continue.
We need to make sure that both the Territory and Federal Government supports the Primary Healthcare Access Program.
It's about not only dealing with the issues and development in your region, but also linking it back so we're doing it consistently with the rest of Aboriginal Australia.
Although it resulted in a considerable increase in funding, when the program was cut in 2006, its expansion to the top-end zones was not fully realised. Of more lasting success was the establishment of the Sunrise Health Service in 2005. A direct result of a coordinated care trial with Jawoyn communities, it demonstrated that regionalised community control can produce better services, with noticeably improved outcomes. The Northern Territory Emergency Response of June 2007, commonly known as the Intervention, radically changed the political landscape for Indigenous Territorians. While AMSANT was critical of many aspects of the intervention, we did engage with it. This led to the Expanding Health Services Delivery Initiative. Set up to progress the Closing the Gap policies, the Joint Commonwealth and Territory Government scheme brought significant increases to primary health care in the Northern Territory. Parallel with the intervention, AMSANT has worked closely with both governments through the Northern Territory Aboriginal Health Forum. And in 2009, an agreement was signed providing for Aboriginal community control over comprehensive primary health care for years to come. Since its establishment, AMSANT has advocated for community control and adequate funding of Aboriginal health services in the Northern Territory. We have also been an active voice nationally for the sector. We are proud to be national leaders in e-health, and that currently our member services have achieved almost 100% accreditation under clinical and organisational standards. We firmly believe that allowing Aboriginal communities to control their own services is key to closing the gap in Indigenous disadvantage.
I'd like to congratulate AMSANT on their 20 years.
And congratulations to all the community controls for their 40 years.
They've done a real marvellous job so far.
We all need one voice, and AMSANT is the voice to bring us forward.
Who would have thought with the inception many years ago of AMSANT, its survival throughout many years of changes, both politically and financially. So well done, AMSANT.
I'm certainly proud and honoured to be a part of this struggle.
Kala, I'm partying too hard.
In the last 20 years, it has been a big learning curve for AMSANT and all of our members. We've now demonstrated the capability and our capacity to deliver a very, very important community service and programs to all our Aboriginal people here in the Northern Territory. And we're hoping that the next 40 years would be on equal par.
AMSANT's fundamental aim is to improve the health of Aboriginal people. We believe that over the past 20 years, we've come a long way towards making this a reality. Happy 20th AMSANT and happy 40th Congress. We are proud of our history of caring for our health, our way.